Kitchener-Conestoga.
Yes, thank you, Speaker. My question is to the Minister of Health. As the Minister knows, for too many years now, we've seen too many patients forced to travel to Queen's Park to plead with government for life-saving and life-transforming medication and treatment for rare disease. In the last year alone, and today, I brought in families whose heart-wrenching stories cry out for government's attention. Many going into debt to pay for life-saving treatment government is failing to provide. Speaker, I've launched a website, treatraredisease.ca, where people can share stories and speak to the need for healthcare support we all deserve. And this morning I announced my private member's motion calling government to strike an all-party select committee to develop recommendations for funding of rare disease treatment. Will the minister commit today to support my motion for meaningful, long-term solutions for rare disease sufferers here in the province of Ontario?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. And, Mr. Speaker, I applaud the member opposite for his advocacy on behalf of individuals living in this province with rare diseases. And it can be as much as 6% of our population, Mr. Speaker. I think actually as high as 8% of the population that suffers from rare disease. I also want to acknowledge the courage of those that came here, that were invited by the member opposite, that came here today to tell their very difficult stories about how they've struggled with these rare diseases, including the challenge in our healthcare system of proper diagnosis. But, Mr. Speaker, it's important that the public know that Ontario, in fact, is co-chairing and leading a process nationally across the country. We've established a committee nationally specifically to develop a strategy for rare diseases in this country. Ontario is leading that effort. We're co-chairing the process.
Answer.
We expect, as a result of that process, to be able to have improvements in this province so we can provide the care these people so rightly deserve.
Thank you. Supplementary.
Yes, Speaker, this all-party committee would hear from experts, physicians, drug manufacturers, and most importantly, rare disease patients in a meaningful dialogue instead of the press conferences they are forced to hold to get your attention. Minister, I'm sure you agree that patients deserve more than words of understanding from government and a pat on the back when they are at your doorstep and the cameras are on. This all-party committee will review recommendations government has already received and hear from experts to make sure patients suffering from rare diseases are treated fairly in the system. It's my hope that an all-party select committee will unlock that process that has long remained out of reach. Will the minister join me and support my call to strike the select committee into funding and treatment for rare disease in Ontario? Yes or no?
Thank you. Minister of Health.
Well, thank you, and I certainly look forward to the debate on your private member's bill. But it's also important that long before the member opposite had his press conference several weeks ago with patients that were suffering from Ehlers-Danlos syndrome, long before that, months before that, we struck a committee in government specifically on EDS, an expert panel where we brought together all the experts across the province. And I made a commitment when he brought those patients to Queen's Park. I made a commitment to them that day that I would invite them to participate in that panel and speak to that panel so the panel would understand their specific circumstances and the challenges that they face. Well, I'm happy to report that 2 weeks ago I joined those families and those patients in front of the expert panel on EDS so that panel could hear directly from those individuals. It's important that we focus on the patients, and we need all the partners, Mr. Speaker. We need our drug companies like Alexion, which has perhaps the highest drug in the world, that chooses to sue our federal government instead of working proactively with us so we can deliver those medicines to those who dearly need them.